Surgeons in training spend hours with devices called box trainers to hone their skills before operating on patients. These medical students and resident physicians are practicing a type of surgery called laparoscopy. Doctors perform the procedure by making a small incision in the belly button and then inserting thin instruments, including a laparoscope, into a patient's body. A laparoscope has a small camera and a light, so the surgeon can see inside the patient during the procedure. Recovery from laparoscopies is fast. There is less risk of infection, and there is no visible scar. It requires a steady hand and a lot of practice.
It's trickier than it looks, but I think this is good practice.
Medical students have limited practice time. At the University of Missouri, engineering students built a box trainer with materials purchased from a local hardware store. They added a camera and worked with the medical school to make the device a workable training tool. Luciano Aleruzzo is an engineering student. He worked on the project.
Ours is better than the current ones on the market.
Dr. Nicole Fearing is a professor of medicine at the university.
This device is especially helpful because it's portable and it's cheap.
The device costs less than $500 to make, 1/3 the price of commercially produced models.
If we can get medical students and residents training out of the operating room first and practicing procedures, knowing how to use cameras, knowing how to use instruments before they get in the operating room, once they get in there, they're safer, they're more efficient, and it's just that much better care for the patient.
The box trainer the engineering department built is a prototype that medical students interested in more practice could make on their own. Carol Pearson, VOA News.